Dr. Robert Shire. It's been a long time. We've had the pleasure of working many, many years together.
Yes, we have.
I know that you have a really unique chiropractic calling. Share that with us. I think everyone would love to hear that.
Well, it's been a long time. We've been working together for 15 plus years. Wonderful, very successful years. So my chiropractic calling came about as a result of my wife asking me some pretty tough questions on our honeymoon while honeymooning in Hawaii about what I was currently doing, which was working with my family in the gemstone business that I didn't really particularly love. And she asked me some questions like, well, what do you want to do in the next 5 years, 10 years, 20 years of your life? So I met this chiropractor, happened to be in the hallway down the hall from where our offices were, Dr. Peter Lawrence, who became my first chiropractor and directed me down to Life University in Marietta, Georgia.
See, all this came about by listening to the wife.
That's it.
It's very impressive. What inspires you?
About chiropractic?
Personally, what personally inspires you?
Oh, wow, that's a big question. What inspires me is truth. What inspires me is life. Seeing people fully expressed in their life and living their truth in the most authentic way possible, I think is
and what inspires you professionally?
What inspires me professionally is people realizing their own health, who realize that they have a doctor inside of them, and that when they do the right things, like get adjusted, eat right, exercise, things that we, coach our patients to do, that they're going to activate that inner doctor, that innate healing potential.
It's funny, I've never heard that term. Everyone has a doctor inside of them.
Yeah,
that's great.
Best doctors right inside.
Tell me a little. I mean, you do a lot of amazing things. You have a lot of great stories. Give our listeners a bit of a fun fact for you.
About me personally?
You personally.
A fun fact?
Yeah.
Fun fact about Rob, I used to be an ice screamer for Ben & Jerry's, which meant I would make ice cream in Burlington. Ice cream, and Ben Cohen, co-founder of Ben & Jerry's, walked in, and I didn't even recognize who it was until as he was actually on my T-shirt that I was wearing that day.
Right. It's funny. I thought you were going to say how you were a collegiate gymnast.
That was my other one. On the next interview, maybe I can.
All right. I know we have so much to discuss. Tell me professionally and technique-wise, we have a couple different chiropractors at True Whole Care, and what makes you different than the others? What do you love to do? That kind of stuff.
Well, what makes
you what makes you unique? Your brand of chiropractic is unique than everybody else's in this world. What is yours?
All right. That's a good question. Hey, my unique brand of chiropractic is all hands-on, instruments at all. I do a lot of work with pregnant women and helping them not only relieve their musculoskeletal, also utilizing a technique called the Webster technique, which has been very effective at helping to align the mother when the babies are in a breech position other than head down. And by just simply aligning and balancing them out, allows the baby to turn naturally. And
that's a low force technique?
That's a very low force technique. It's really more of an analysis than a technique. Okay. But it analyzes where the mom's out of balance, mostly in her sacrum, low back, pelvis area, identifying the areas of interference and resistance, clearing them out. And then it really allows, again, that inner doctor to create space for the baby to turn and go head down so she can give a natural childbirth.
And now I've been asking everyone, like, what's their ideal patient? If a patient walks in, what makes you really happy about it?
I think the ideal patient is somebody that comes in with a problem and then listens to the recommendations and then follows the recommendations, because we can only do so much for them while they're actually in the office. So much of the responsibility in anyone's health relies on one's self to take action. So I love it when those patients come back after a visit and say, you know what, that was great. I felt great after the adjustment. I went home, I did the exercises, I did the stress, I've been doing them consistently, and I'm feeling much better. To me, someone that's engaged in their own healthcare,
That makes you happy,
on over.
right? It's nice when we become partners in this rather
Yeah,
than just
it's a
trying to.
partnership.
Yeah,
Yeah, we don't do all the work.
right,
It's got to be it's a tennis game,
right,
right?
exactly. I know you have thousands of success on that you love to share with people, or could you share just one of many success stories?
Well, I'm the first one that pops into my mind, and this doesn't happen in a unique situation, but I did have a woman who came into my office. She was about 38, pregnant, and her baby was breech, and she really left it to the last. She was going in, I think, a couple of days later to have an aversion, an ECV, external cephalic version, where the OBGYN actually physically moves the baby to try to change it. And she came to me for the Webster technique, hoping that I would be able to perform a miracle. And lo and behold, we analyzed her, with stations, her areas of interference were. I adjusted her. The next day, she went to her OB. They did an ultrasound, and the baby had turned in one
That's
adjustment.
awesome. You love when you have these success stories, and you know how they fully happen, but they happen. We help along, and it's wonderful.
Exactly.
I can tell you personally that it's been a true joy having you side by side for this long and being together at True Whole Care. Um, and joy, honor, and a pleasure to truly work alongside you. Tell me your feelings and your thoughts. What do you love about True Whole Care? What really works for you, and what makes.
So True Whole Care is a unique model, and kudos to you for organizing, setting it up, and putting everybody to getting the team together, essentially, because it's really a unique healing environment where we have so many different practitioners of different specialties who are all very talented in their own areas, to be able to refer to patients when they need a great physical therapist to rehab, or a great physiatrist, like I needed recently for myself, for an injury. It's just a great place. It's a great family of practitioners that we refer to, that I feel comfortable referring to give my patients the care possible, that they can get it without having to go anyplace else, just right. So it's a wonderful place.
Because you're there. So thank you. And thank you so much for taking the time. I really appreciate it.
I appreciate you, and thanks for setting this up.